I'm Harah, student nurse from Our Lady of Fatima University. So, sir, may I see your response? Complete name?
Alejandro Agar Macaal.
Okay, Alejandro Agar Makaalay. And your birthday?
March 27, 2004.
Okay, March 27, 2004. And how old are you?
18.
Okay, 18 years old. So before we start this assessment, I will ask some questions to you for the collection of subjective data. Okay, sir, do you have any complaints right now?
No.
Okay, do you feel any pain in your chest or in your extremities?
No.
Okay. Have you experienced shortness of breath, dizziness, or headache right now?
No.
Okay. Is there any history of hypertension, myocardial infarction, or coronary disease that has affected in your family?
No.
Okay. So, do you smoke?
No.
Okay. So, what is your usual activities?
Playing online games and answering my modules.
Okay, I will take note of that. So, for the last question, do you exercise?
No.
Okay, no. Okay, so thank you, sir. So, sir, for this assessment, this is essential for detecting any significant factors that can influence the cardiovascular health, such as high blood, diabetes, cigarette use, hypertension, or any non-cardiac disease that may affect the heart. Okay, so rest assured, sir, that all the documents are completely confidential between me and the attending physician that I'll be referring to you. So let's start the assessment, sir.
Yes.
Okay, thank you. So for the first assessment, I will be inspecting the carotid arteries of the patient. Okay, sir, please turn your head like this. Okay, to the other side. Okay, so after inspecting the pulse waves or the carotid arteries of the patient to his left and right carotid arteries, his pulse waves are visible and it is in a normal finding since the carotid arteries are the only site for the assessing the quality of the pulse waves. For the palpation of the carotid arteries, we should likely to avoid the blocking circulation or triggering the vagal stimulation and the bradycardia, hypertension, or even cardiac arrest. So, palpate the carotid arteries individually because the bilateral position of the carotid arteries may be reduce the cerebral blood flow. The bilateral pulses are equal. They are also equal in terms of rate, rhythm, and strength. And also they are elastic and has thrusting quality, which is in a normal finding. So let's proceed for the auscultation of the carotid arteries using this stethoscope. Okay, so for this, I will focus or take note of if there's any signs or presence of a bruit. So bruit is a blowing or swishing sound that may cause a turbulent blood flow through a narrowed vessel, which is indicative of occlusive arterial disease. Upon auscultation, sir, I don't hear any sounds on your carotid arteries, which is in a normal finding. Okay, I'll be inspecting for the jugular vein of the patient. So for this inspection of this vessel can be helped for the identifying the blood volume and the blood pressure of the right side of the heart. So I'll be using pen light into the suprasternal area of the neck and to the area of the clavicle area to observe the pulsations or any shadows within. So, note that the jugular vein should not be distended, bulging, or protruding at 45 degrees or greater, because if so, it may indicate a right side heart failure. Next, I will measure the vertical distance in centimeter of a sternal angle. Okay, sir, can you please turn your head? Okay. Upon inspection, I don't see any distension on your jugular vein, sir. So, which is in a normal finding, and your venous jugular pressure is in a normal upper limit of 4 centimeter. So, let's proceed for the inspection of the precordium. Okay, sir, please breathe normally. Inhale, exhale. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, thank you. Upon inspection of the chest, it is symmetrical, no signs of extractions, and I don't see any presence of hips, which is in a normal finding. So for the next one, I'll be palpating the precordium of the patient and using the palmar surface of my hand. Okay, sir, please relax. Okay, so now I'll be palpating the specific cardiac landmarks. Okay, so let's begin with the aortic area. Next to the tricuspid area. The pulmonic area. And then down to the Erb's point, to the mitral area, okay, so now using the 2 or 3 fingers, I'll be palpating for the apical impulse of the patient. So I have observed that after I palpate the chest of the patient and checking for the palpation of the specific cardiac landmarks, I don't feel any exaggerated lifts or heaves in his chest, which is in a normal finding. We will now proceed for the auscultation of the chest or the precordium part of the patient. Okay, so let's begin with the aortic, which is found in a right sternal border at the second intercostal space. And down to the pulmonic area, which is found in a left sternal border at a second intercostal space. And to the tricuspid area, which is found in a second border or second sternal border at the fourth intercostal space. Okay, down to the orbs point. To the mitral area. And last one, to the apical area, which is found at the fifth sternal border at the mid-clavicular area. So sir, upon auscultation of your landmarks, your S1 and S2 are in a distinct and all areas are in a normal finding, and I don't observe any signs of splitting sounds of a heart, and no murmurs or trills heard, as well in S3 and S4. Overall, they are in a normal finding. So sir, please change your position in a sitting position so that I can auscultate your cardiac landmarks again. Okay. Let's begin again to the aortic area. Okay, the pulmonic area. Tricuspid area. Herb's point. The mitral area. And lastly, the apical area. Okay. I'm done for the assessment of cardiovascular system, and for now I will proceed for the assisting the patient to replace his clothes again. So sir, you can now change your clothes and be back again for the results, okay? Okay, you can now get up and change your clothes. Now I will record the document of all the findings that I have gathered in this assessment. So sir, overall your cardiovascular system, sir, is in a good function and it is doing very well. So sir, for the last questions, do you have any clarification or concerns?
No.
Okay, none so far. So sir, thank you very much for the cooperation.